friends, today we are going to continue the topic of mammary gland, and those who haven't watched the part 1, please go and watch it. So let's continue from lymphatic drainage. It assumes great importance to the surgeon because carcinoma of the breast spreads mostly along lymphatics to the regional lymph nodes. So let us divide the lymphatic drainage into two topics such as lymph nodes and lymphatic vessels. So let us talk about lymph nodes. Lymph from the breast drains into the following lymph nodes. Number 1. Axillary lymph nodes, chiefly the anterior or pectoral group. Also the posterior, lateral, central and apical groups of nodes also receive lymph from the breast either directly or indirectly. Second, internal mammary or parasternal node, which lie along the internal thoracic vessels. Number 3, some lymph from the breast also reaches the supraclavicular nodes, the cephalic or deltopectoral node, the posterior intercostal nodes lying in front of the heads of the ribs, the subdiaphragmatic and subperitoneal lymph plexuses. Now let us talk about lymphatic or lymphatic vessels. So number 1, superficial lymphatics, which drain skin over the breast except nipple and areola. Lymphatics pass radially to the surrounding lymph nodes such as axillary, internal mammary and supraclavicular and cephalic nodes. Now deep lymphatics drain parenchyma of the breast, also nipple and areola. Now let us talk about some important points. So the lymph from the breast drains 75% into axillary nodes, 20% into the internal mammary nodes and 5% into the posterior intercostal nodes. Among axillary nodes, the lymphatics end mostly in the anterior group and partly in the posterior and apical groups. Lymph from anterior and posterior groups passes to the central and lateral groups and through them to the apical group, and finally it reaches to the supraclavicular nodes. Now the internal mammary nodes drain the lymph from the inner and outer half of the breast. Now this is the important point, that is a plexus of lymph vessels is present deep to the areola, known as the subareolar plexus of Sappi. Subareolar plexus of Sappi and most of lymph from breast drains into the anterior or pectoral group of lymph nodes. Now, lymphatics from the deep surface of the breast passes through the pectoralis major muscle and clavipectoral fascia to reach apical and internal mammary nodes. Next, lymphatics from the lower and inner quadrants of the breast, that is lower medial quadrant, may communicate with the subdiaphragmatic and subperitoneal lymph plexuses after crossing the costal margin and then piercing the anterior abdominal wall through the upper part of the linea alba. Now, let us talk about the development of the breast. Breast develops from an ectodermal thickening called mammary ridge or milk line or line of skull. This ridge extends from axilla to groin. It appears during 4th week of intrauterine life, but in humans it disappears over most of its extent, persisting only in pectoral region. The gland is ectodermal and stroma is mesodermal in origin. Number 2. Persistent part of mammary ridge is converted into a mammary pit. Secondary buds, which is 15 to 20 in number, grow down from floor of pit. These buds then divide and subdivide to form lobes of the gland. The entire system is first solid but is later canalized. At birth or later, the nipple is everted at the site of original pit. Number 3. Growth of mammary glands at puberty is caused by estrogen. Development of secretory alveoli is stimulated by estrogens, progesterone, and by prolactin hormone of hypophysis cerebri. Number 4. Developmental anomalies of the breast are amastia, which is the absence of the breast, athelia, absence of nipple, polythelia, supernumerary nipples, that means more in number, polymastia, supernumerary breast, gynecomastia, development of breast in a male, which occurs in Klinefelter's syndrome. Now let's say the lymph node draining the breast. So there are 5 axillary lymph nodes, and they are anterior axillary, posterior axillary, lateral axillary, central axillary, and apical lymph nodes. So there are 5 axillary lymph nodes, and lymph from the anterior as well as posterior goes to the lateral and central lymph nodes, and from here to the apical lymph nodes, and from the apical lymph nodes it passes to the supraclavicular lymph node. And these are the internal mammary lymph nodes, and here is radial incision.